Hi everybody, I'm Elise. I'm our social media manager at Faces Plus, and I'm here with none other than our Dr. Cohen, our plastic surgeon and medical director. Today we're going to run through some questions about facial fat grafting that you should know if you're considering this procedure or if you thought about it and had questions that you need answering. I'm going to look on my phone. I have some questions from Realself that people wondering about this procedure have asked, and I'm just going to read them off for Dr. Cohen, and he's going to answer them as a pioneer in the field of facial fat grafting with his expertise. Okay, question is, would it be a good option to get fillers and fat transfer in combination?
Fillers and fat grafting can be done in combination, but you have to be kind of careful with that. One, the fat, when you inject it, is really now not alive. It has to go through a process of receiving a blood supply. In some cases, it may be better to wait a few weeks or even a month to allow the fat graft to establish itself before placing the filler. Now, there are new techniques that we use and have used where some of the cells from fat, called nanofat or stromal vascular fractioned fat, can be combined with certain types of fillers, for instance, to achieve a longer lasting augmentation of the chin, or to try to effectively stimulate the tissue as the graft or the fat graft is taking hold. I think that in general, combining fillers and fat grafts should probably be done serially, one after the other rather than at the same time.
Next question, is it possible to have PBL and facial fat grafting done at the same time, or would it be better in two separate procedures?
I think it doesn't really matter. Once we harvest fat, the fat can be placed anywhere you need it. So we frequently will do BBL with fat grafting to the breast, fat grafting to the face, fat grafting to the hands. So that's a very common procedure. Obvious advantages of that are you're treating all areas with that fresh fat that has just been harvested, and providing you have enough to go around, it's absolutely not a problem to treat these areas simultaneously. In fact, I think it's actually better to do that.
Next question, how long is the facial fat transfer recovery?
When we do our procedure, which is unique because not all facial fat grafting is the same. So if somebody has been trained here, they're doing a fat grafting technique called injectable tissue replacement and regeneration. This is a trademarked and patent pending process. This allows us to treat anatomically all areas of fat loss. So rather than just treating aesthetically, the fat is not like a filler. It has to be placed anatomically. Otherwise, if you gain weight and you have too much fat above, for instance, the eyelid and above the muscle, you will have to go back in to remove that. And that is going to be problematic, and patients are going to look a little bit different and a little bit odd. So fat has to be placed in the deep compartments, which are below the muscle, a different type of fat graft above the muscle, and yet a third type of fat graft that is used to stimulate and improve the skin texture, the skin coloration, thickness, and wrinkling. It's very important when we're doing fat grafting to address, one, what is the technique? If it's done purely like a surgical artist, it may look good on the table, it may look good for several months, it may look good while your weight is stable, but then it may change. So the technique that we use is a very specific and very different technique that so far it does not seem to be associated with any of these issues.
Next question is, fat transfer absorption occurs at what time frame after injection?
Well, right after injection, you're a little swollen, and as the swelling goes away, there's a perception by the patient that they're losing that fat, but really they're losing just the edema tissue and the swelling. Once the swelling is resolved, there's a little bit of what appears to be deflation, and you'll see that somewhere around 2 weeks. And then what seems to happen at about a month to 3 months, you actually start to notice that your skin is thickening, that you're actually getting an improvement in result, because what's happening is that fat is remodeling. The fat that survives is getting a better blood supply, is starting to bulk up. The stem cells that survive are starting to produce new fat cells.
Last question, how does a fat transfer age?
So a fat transfer ages in an interesting way. We've recently published a paper in the Aesthetic Surgery Journal that discusses that exact point. If you do injectable tissue replacement and regeneration as your fat graft technique in combination with the facelift, the aging or the remodeling of the fat graft is very interesting. At a month, we see about a 40% improvement in facial volume, because it's very hard to measure the fat graft survival, but you can get an estimate by measuring facial volume with 3D photometry. At about 7 to 12 months, that fat graft has declined so that facial volume now is about 30% improved from the preoperative status. But at 24 months, with no weight gain in any of these patients, the fat graft now is at 75%. So the facial volume had actually improved over this 2-year period. So in certain patients who have good genetics, remember the fat that we're using is your fat, so it's controlled by your DNA. And some people age rapidly and have worse tissues, and other people age slowly and have better tissue. So to some extent, depending on that situation, we can see improvement in the quality of the skin, in the thickness of the skin, and in these fat pockets for at least 2 years, possibly much longer.